Thank you very much for inviting me to share these results from one of our projects here at icipe. As you correctly introduced, icipe is the International Center for Insect Physiology and Ecology. We are based in Nairobi, but we have our satellite offices in Western Kenya and also in Ethiopia. And we work with partners all across Africa. Today I'm going to talk about the farmers' perceptions and willingness to pay for a novel livestock pest control technology, which we call the tsetse repellent collar. This is based on one of our work that we did in Kwale County of Kenya, one of the heavily tsetse infested areas in Kenya and also in Africa. And this work has been published in PLOS Neglected Tropical Diseases. And I must say that's why I think Marianne got our work, and she requested that we share, or rather I share on behalf of the other co-authors this work. So I'm honored to share these results, and feel free to ask questions. And yeah, I hope you'll find the presentation interesting. Just a way of introduction, livestock, of course, as we all know, contributes significantly to the agricultural GDP and supports quite a significant number of smallholders in developing countries. And this is through employment, of course, income, and improving crop productivity through provision of draft power and manure. And therefore, any effort to reduce poverty and improve food security and nutrition requires the use of livestock to the full potential. However, livestock production is constrained by various challenges, and one of the biggest challenges, the tsetse transmitted and more African trypanosomiasis. And this is actually highlighted as one of the major livestock development challenges in Africa. The ATT, as I'll call it, moving forward, causes anemia, emaciation, and production loss, and of course mortality. And it's estimated that it causes about 3 million cattle deaths in Africa, in sub-Saharan Africa. And of course, about 46 million cattle at risk of contracting the disease. Therefore, direct production losses are estimated to be about 1.2 billion each year. And the vector, the tsetse that transmit ATT, occurs in landscape of about 37 sub-Saharan African countries. So this, of course, we can say it's a major threat to livelihood of so many households, and especially the poor and vulnerable households in the rural areas. The main method that has been used to curb ATT has been the use of trypanosomiasis, or rather the drugs. However, we know all the associated drug risks with drug use, including drug resistance and other health concerns with the drug metabolites in the animal products, milk and meat. And therefore, there is a need to have alternative control measures that really target the vector instead of targeting the disease. And over the years, icipe has developed both community level and also hard level strategies. And this picture here summarizes the different kinds of community level and hard level strategies. So as you can see, at community level, we have the tsetse fry traps, the targets or the screens, which impregnated or have insecticides, and then we have the pawns technologies. And although these first three, the community level strategies, are also eco-friendly, they are they're expensive to implement and also hard to sustain, because partly they are viewed as public goods since they are applied at area-wide level, and therefore they have been a bit difficult to sustain. Therefore, icipe has more focused on the household or hard level strategies, and this is where we have this novel tsetse repellent collar. These are just highlights of some of the pictures of the collars, which has advanced. If you see on we have this second one here with the metal bar. This was the very initial concept, which was not cost effective. After assessing whether it was feasible for the smallholder farmers, we realized it was not feasible. So there was need to revise or to come up with another cheaper material that farmers could have afford. And this is how this canvas collar came about, which is the current one now in the market. And down here you see the tsetse repellent brand, packed as a sachet and also packed as a bottle. So a number of studies have been done on the efficacy of the repellent collar, and it has been found to be safe to the humans, to the livestock, and also to the environment, and also effective in reduction of the AAT infections. And although the collar exhibits all these economic and environmental benefits among the livestock farmers, it hasn't been commercialized since it has been on more or on trial basis. So wide commercialization and adoption of this technology will depend so much on how farmers conceive or how they perceive the efficiency and also the cost, and if they accept it. And this is why this study was actually done to assess farmers' knowledge, first of all, and their perception and practices towards management of tsetse flies and ATT, and evaluate or assess their willingness to pay for this novel collar, and also highlight factors that may affect the willingness to pay, both positive and also negative. So to do this, this work was carried out in Kwale County, as I mentioned at the beginning. Kwale County is one of the heavily tsetse-infested areas in Kenya, with a preference of about 56%, and therefore considered as a hotspot for the tsetse. And we followed purposive sampling method to select the sub-counties and the wards and the villages. As you can see on this picture, we have the National Reserve in the middle there. The National Reserve is actually a reservoir of many tsetse flies and alternative hosts of the fly. And that's why there is a huge burden of control of tsetse and ATT around this area. And so the selection, we selected, as you can see on the map, the green dots there, which represents the sampled farmers. They are just villages that are adjacent to the park, and we use proportional probability proportional to size approach, just to distribute the sample across all the different locations. And our study involved 632 households, which were randomly selected. And then to assess or to decide the willingness to pay, many of you may not be probably conversant. We use many methods, but for this study we chose to use a contingent variation method to decide the farmer's willingness to pay for the collar. And basically we chose this because it's a survey-based stated preference method where producers are evaluated on a product that has not yet been traded in the market. And there are three different kinds of approaches that could be used. This is what we call the single bounded CV model, or the double bounded, or the multi-bounded. I'll not explain all that, but for this study we chose what we call double-bounded CV model, and the double-bounded is just means that there's a first offer or the first bid that is offered to the respondent, and then a second bid that is dependent on the first one. So once the respondent says yes to the first bid, a lower bid is offered, and a higher bid is offered, and the same case when they say no, then a lower bid is offered. And just to expound a bit on how we recited this willingness to pay, the first stage was first of all to assess the farmers' awareness of the tsetse repellent collar technology, but just ask them whether they have ever heard about the technology. So irrespective of the awareness, the respondents were presented with a short explanation of the scientific background of the collar technology. This included the benefits, and not just the monetary benefits, but also the environmental benefits, as well as the costs. And then we presented these pictures that shows the older version of the collar as well as the new version that is due for commercialization. And as you can see, the costs are stated there. The new canvas collar is estimated to cost about $1,475 per year per animal. In fact, before we did this, we did not reveal the cost because we wanted first of all to ask the farmers, which is the next stage here, to state their costs that they go. I mean, for treating an animal for tsetse and ATT per year if they do not have other technologies like this one. So once they stated that amount, that was our first bid, called the double-bounded CV approach. So that was our first bid. And then whatever that bid was, we asked them, would you be willing to pay for a collar that costs the same amount to service the whole year as your treatment for animal for 1 year? So if they said yes, then we added premium, which we added a certain percentage of premium, and then asked them again, would you still be willing to pay if we increase this amount by a certain percentage? And this percentage is just programmed. There were four different random percentages, which they were randomly picked by our program, the software that we use for data collection. So this is how we did it, and you can see the pictures. And then I will not dwell on the regression, on how we calculated the mean willingness to pay, and also how we calculated the dependence of willingness to pay. So the results, I'm going to highlight a bit more of, first of all, the descriptive analysis, just to give give a background of how the cattle keeping in the area is, and also livestock pests, how farmers perceive the different pests and diseases in the area, and also some of the practices and awareness or knowledge of the farmers about the disease and the pest. So as you can see on this slide, livestock ownership in Kwale, most of the farmers own indigenous cows, and this is somehow cultural, but also dependent on the suitability of the animals within this area. The exotic breeds, they don't do well, and this is mainly because of the high infestation of tsetse and ticks, according to the farmers and also according to the county government, because they also gave the same sentiments about the non-suitability of exotic breeds in the area. And the majority of the farmers actually keep animals for draft power. That's why you see so many of them with oxen, and they had a mean of about 2.8 oxen per household. And of course, we had other categories of livestock. When it comes to pest and diseases, as I mentioned, or rather, as we expected, tsetse flies and ticks were highlighted as the major livestock pests or major livestock constraints in those areas. And in terms of diseases, tsetse vectored trypanosomiasis, and among others, you can see also the East Coast fever is the disease associated with tick, and among other diseases. And then the next question was, then how are the livestock management technologies available in the area? And as you can see here, we sought to know whether vaccination are available, curative treatment, natural breeding, artificial breeding. And you can see our close, for instance, AI is not very common. I think this was expected because most of the animals are indigenous, and but of course this was also cited by some of the farmers that there are not so many health experts within the area who can administer AI to the animals. On farmers' knowledge, perception, and management of tsetse and trypanosomiasis, we asked about the different clinical signs and symptoms of trypanosomiasis. And our target was to see how many farmers could correctly identify for about 4 ATT clinical signs. And we realized only 22 of the respondents could correctly identify the disease, implying that there's a gap in knowledge. Of course, if the farmers don't have good knowledge on the disease, then they are likely to misdiagnose their animals, and of course that leads to wrong treatment. However, asking them about the perceived tsetse infestation and severity of the trypanosomiasis, there was, positive, or rather you can see most of the farmers perceived the preference of the tsetse to be low at that time, and also mortality. And the low preference rate was associated with CPES effort in introducing the household and community level tsetse control methods. And since we had done a focus group discussion before we did the survey, the same sentiments were highlighted by the focus group discussion respondents, that ATT had reduced, preference had reduced, and also the mortality of the animals had significantly reduced since icipe started working in the area. The other question was then what are the strategies the farmers use other to control trypanosomiasis and tsetse? And we see cultural practices still playing quite a major role. For instance, avoiding tsetse infested areas. Those are the areas next to the park. Taking the animals out to graze, and clearing bushes. Those still play a big role in, or rather, farmers perceive them to still play a big role, and they could be promoted along the tsetse control technologies. But as you can see in this slide, we still have a significant number of farmers still using trypanoside, the drug for control of ATT. And of course, what we found is that not so many, although they were using them, they did not perceive them to be very effective. And unfortunately, not so many of them were aware of the negative effects of the use of these drugs. And also the disposal, there's still gaps in how they dispose leftovers of these drugs once they spray the animals. But what we learned from the qualitative survey, the earlier FDG discussion, although these gaps are still identified here, most farmers said that they had improved their knowledge on treating the animals, and how they determined the amount of chemicals to use and the timings through some of the trainings that have been offered by icipe. When looking at the willingness to pay for the collar, what you see here, for instance, we had when we offered the first bid, and the first bid I said was the cost that a farmer incurred to treat an animal for ATT and tsetse for the whole year. That's buying the drugs as well as others, spraying and all the other methods that they were using to treat the animals. 63% of them agreed, or rather were willing to pay the same amount. On average, this was coming to about $2,673 or about $26 per animal per year. 63% of them agreed. The 37% that rejected that first bid were offered a discount, as I said, between 15 and 60% of the first bid. And when we offered this, for instance, those who were offered 30% of the bid, 39 of them accepted, adding this to by 7% of those who accepted. On the other hand, those 63% were offered a premium, or rather the price was increased by a percentage of between 15 and 60. And when this was done, only 14%. This is not, it's supposed to be the other side. Only 14% of them accepted. But of course, we expect the percentage of additional accepting to go to reduce as the amount increases. Looking at the mean willingness to pay, this is the logistic analysis. You can see the first. We have the conditional and conditional. The conditional means we assume that there are no other factors affecting willingness to pay. So we do not include the explanatory variables. And what we saw, the mean willingness to pay was about $33.51 or about $33. And this is about 23% over and above the average cost of treating one mature animal for tsetse, fries, and ATT complication per year. And even after we added the other explanatory variables, which is the conditional model up there, we still got a significant, or rather a mean willingness to pay higher by 23, or the other one is 25, by 23%. Over and above the average cost of treating a mature animal for tsetse. And if you recall, the cost of icipe tsetse collar is estimated about $1,475, or about $15 per animal per year. So the willingness to pay is much higher than the estimated cost of the tsetse repellent collar. Of course, then implying that there is hope that this collar is going to be purchased. And I must say, now it's about 2 years since we carried out this survey, and since then, farmers have actually been purchasing these collars. Just a highlight of the factors affecting the willingness to pay. We saw gender, education level, and perception that the disease is a higher preference then affected the willingness to pay positively. The gender finding is expected, as female heads are often associated with limited access to production resources that facilitate or that would facilitate adoption of new technologies. Well, of course, education enhances processing and interpretation of new information, and overall production constraints and increase of farm inputs. As a way of conclusion, or to summarize my my study, where, as you recall, the results shows that most of the farmers reported tsetse flies as the leading indicator in infesting pests in the area. But there was a knowledge gap of by the fact that only 22% of the interviewed farmers could correctly identify at least 4 clinical signs of the disease. But although we see many of the farmers using the drugs to for management of the disease, 50% of them did not perceive the drug to be effective. And but unfortunately, only a few also are aware of the harmful effect of the triponocidal drugs. And about 89% of the respondents were aware of the icipe tsetse repellent collar, and 30% of them, I didn't mention this, were already using them had used them for field trial. And 63% of the respondents were willing to pay for icipe tsetse repellent collar at the same cost as treating their own animals for ATT. And on average, the willingness to pay was about $34 per animal per year. So as a way of recommendation, looking at our results and also using complementary information from the focus group discussions, and this is a picture of myself conducting the focus group discussions, we recommend wider dissemination and commercialization of the high-level tsetse control approach to reduce AAT transmission and thus enhance food security and farm incomes among the affected rural communities. And besides the uptake of the tsetse repellent collar, can be enhanced through training to bridge these gaps that have been identified, and also encourage women also to join the trainings, and therefore enhance the adoption rate in these tsetse-prone areas in Kenya. And just to mention, we have also published recently a paper on potential economic benefits of controlling trichomoniasis using the same repellent collar, this one focusing on sub-Saharan Africa. And we have other papers that are upcoming, microeconomic impact of the tsetse collar interventions, and also evaluation of the economic burden of the disease in Africa. And with that, I want to say thank you for listening, and I welcome questions.